Welcome to our OSHA Focal Point series. I'm Dr. John Mulroy, Director of the Pennsylvania OSHA Consultation Program, housed in the world-renowned Safety Sciences Department here at Indiana University of Pennsylvania. These videos were created with the essential, need-to-know OSHA compliance information to supplement your safety and health training. Addressing OSHA's most frequently cited standards, like lockout-tagout, fall protection, hazard communication, and machine guarding, these videos can help your organization anticipate, identify, evaluate, and control workplace safety and health hazards. We hope these critical OSHA focal points assist you in preventing future injuries and illnesses. If you still have questions or you need no-cost OSHA compliance assistance, we're here to help. All you need to do is reach out to us at IUP using the link below and request this no-cost OSHA compliance assistance service. It's that easy. Thank you for choosing the Focal Points video series. Be sure to hit the subscribe button to be the first to know when new safety and health content is added to this channel. Have a safe day, everyone. Today's topic is bloodborne pathogens, and the purpose of today's topic is to provide you with the essential, need-to-know information about the hazards associated with bloodborne pathogens in the workplace. So during this short presentation, we will briefly discuss the following topics, which include: what are bloodborne pathogens, who's at risk of exposure, and what steps do you need to take as a worker to prevent that exposure? So what are bloodborne pathogens? Simply, bloodborne pathogens are microorganisms that are pathogenic, present in human blood that can lead to disease. Examples include hepatitis B, C, and even HIV, but it's not limited to just these viruses. Hepatitis B, over 12 million people are infected in the United States with this virus, and essentially 40,000 people become infected every year. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, nausea, vomiting, and ultimately chronic liver disease. Hepatitis C is the most common chronic bloodborne pathogen infection in the United States. Symptoms of hepatitis C also include jaundice, fatigue, abdominal pain, loss of appetite, nausea, and vomiting, and also can lead to chronic liver disease. HIV, this is the virus that leads to AIDS. It affects the body's immune system. Approximately 1.1 million people in the United States are living with HIV today. And once infected, you're infected for life. So what's your risk of exposure at the workplace? Your contamination sources include blood or other potentially infectious materials. When you're in the healthcare industry, obviously your exposure is much higher than any other job site in the United States. But if you're involved in an accident and you're helping a fellow coworker and you're cleaning up blood, you too could be potentially exposed. So what is other potentially infectious material? This includes human body fluids other than blood, any unaffixed tissue or organs as a result of that injury, cultures, culture mediums. If you're working in a lab environment, you may be exposed to these types of hazards. In addition, you may have experimental blood from animals or humans, animal or human tissues or organs infected with HIV or one of the hepatitis viruses. So how does this spread? Well, it can be through direct contact or indirect contact. There may be respiratory transmission or vector-borne transmission, such as a mosquito bite. Risk of exposure. You can be exposed through needlestick injuries, cuts while cleaning up broken glass, contact with mucous membranes, broken skin, other contaminated blood, or other potentially infectious materials. What are the occupational risks on the job site? Those risks include first responders, housekeeping personnel, nurses, other healthcare personnel, or first responders to a site where somebody's been injured. The CDC estimates 5.6 million workers in healthcare and related occupations are in fact at risk for bloodborne pathogens. And all other occupational exposure to blood or other potentially infectious material places workers at risk at the other job sites. So what is our risk of exposure? Clearly, the occupational group most at risk are healthcare workers, and this slide denotes that. So what do you need to have in your workplace? What's the essential need-to-know information about bloodborne pathogens? You need to establish an exposure control plan if there's a risk of exposure in your workplace. That exposure control plan needs to be written. It has to be accessible to workers. You need to review and update that plan annually. You need to review and update any tasks that are modified or new where there's a risk of exposure to bloodborne pathogens. The required elements of the bloodborne pathogen standard are exposure determinations, how we're going to implement our controls to protect our workers, and what procedures we need for evaluating those exposure incidents. Controlling exposures. We want to observe standard precautions, or what we commonly refer to as universal precautions. We want to make sure that we treat all blood and all body fluids, all other potentially infectious materials, as if it were in fact contaminated. You want to make sure that the proper procedures are followed in any cleanup situation. And you want to make sure that all those work surfaces that have been contaminated with blood or other potentially infectious materials are properly cleaned up. We also want to implement any engineering or work practice controls to reduce our exposure. This includes safer medical devices, disposal containers for sharps to prevent needlestick injuries, and making sure that we practice good hygiene. We want to make sure that we're using the correct personal protective equipment. We want to make sure that we're using gloves, masks, aprons, smocks, and gowns, face shields, mouthpieces, safety glasses, and pocket masks if we're performing CPR. All of this personal protective equipment reduces our risk of exposure to bloodborne pathogens. Employer responsibilities. Employers need to perform a hazard assessment. Employers need to identify and provide the appropriate PPE to employees at no cost to them to ensure that they're protected and reduce the potential for exposure to bloodborne pathogens or other potentially infectious materials. Employers need to train those workers on how to use that PPE and how to take care of that PPE, how to maintain it and replace it if it's defective, worn out, or no longer functional, and review, update, and evaluate the written PPE portion of your exposure control plan. We want to make sure that we select PPE that is safe, that is constructed properly, that fits comfortably, and fully protects us. We want to make sure that we're using it properly, so training is essential. We want to make sure that we're using the PPE when necessary, that it's the correct type, that we don it, we adjust it, we wear it, and we doff it, which means taking it off properly. We need to make sure that we understand the limitations that PPE provides and how to care, maintain, and get a useful life out of that equipment. Employee responsibilities. You as a worker, what does this include to ensure that you are controlling your risk for exposure to bloodborne pathogens? You want to make sure that you not only attend training, but you participate in that training. You want to make sure that you're properly wearing your personal protective equipment. You want to make sure that you're caring for, you're cleaning, and you're maintaining that PPE, and you notify your employer when you need to either repair or replace that personal protective equipment. Controlling exposures also includes housekeeping. We want to ensure that there's a written schedule for cleaning and decontaminating all work surfaces in the workplace, that any broken glass or other hazards are picked up and disposed of properly. Controlling exposures also includes cleanup and decontamination. We want to ensure that we wear our protective gloves. We want to ensure that we properly clean and disinfect. We want to make sure that we clean all work surfaces and we are using an appropriate EPA-registered disinfectant. We will wash immediately and thoroughly after any potential exposure. Again, we want to treat all blood or other potentially infectious materials as being potentially contaminated. And then lastly, properly dispose of any contaminated personal protective equipment, any towels, rags, bandages, any gauze, any of the materials that we use to treat a fellow worker. Controlling exposures includes managing regulated waste. After cleanup of blood or other potentially infectious materials, you're going to generate regulated waste. So we need to make sure that we dispose of that regulated waste in closable, leak-proof, red, or properly labeled biohazard bags, and that we dispose of all our sharps in closable, puncture-resistant, leak-proof red containers. Contaminated laundry is another potential risk factor. If your clothing in the workplace becomes contaminated with blood or other potentially infectious materials, you want to make sure that you have a procedure for duffing that clothing and disposing of it properly. If you are in fact exposed to blood or other potentially infectious materials, there are essential need-to-know information about how to deal with this situation. You may have an exposure incident when performing work duties, and you may come in contact with blood or other potentially infectious material, whether you're in the healthcare industry or assisting a worker in a first aid injury. You have to be cautious to ensure that the risk of exposure is reduced through your eyes, your mouth, other mucous membranes, or non-intact skin. If exposure in fact does occur to blood or other potentially infectious materials, you want to make sure that you immediately wash all exposed areas with soap and water. You want to flush any splashes of blood or other potentially infectious materials to the nose, mouth, skin with water. You want to irrigate your eyes with water and saline if you're exposed to blood or other potentially infectious materials. You want to report that exposure immediately to your employer and seek treatment with a healthcare professional. To get more help on bloodborne pathogens, go to OSHA.gov. Thank you.